Good morning, and welcome to the meeting of the Hillsborough Planning for Transportation Disadvantage Committee. We are going to start today's meeting with a workshop. This is our annual workshop on shared mobility services. So we'll have the workshop first, and then we'll adjourn the workshop and proceed to our call our regular meeting to order right after that. And so starting with the workshop, I'll turn that over to staff to lead us through. Mr. Barber.
Thank you, Commissioner. And could we take a roll call real quick before we begin, just to see who is here?
Yes, absolutely. Commissioner Smith?
Here.
Gloria Mills? Here. Glenn Brown?
Here.
Craig Forsell? Tracy Noyes? Here. Emily Huart?
Good morning, here.
Christina Melling? Beth Pasek?
I'm here.
Mark Harshbarger? Nancy Castellano?
Deborah LaCanta in for Nancy Castellano.
Thank you. Dr. Gordon?
Now we'll turn it over to Mr. Barber.
I think we have a few more names to call. Sorry, Commissioner.
I thought it stopped.
Sorry. Dr. Gordon?
Here.
Councilman Vieira or Councilman Schisler?
He'll be a little late today.
Okay. John Pelkey?
Hey, good morning. I'm here.
Nancy Pacificio? Cassandra Blaylock?
Here.
Jody Toner? Artie Fry? Deborah Noel?
This is Mike Lacey for Deborah Noel.
Thank you.
What's our attendance?
Huge. Our attendance is huge.
All right, we still have we have 4 people in the room now. We're still waiting on one more for our physical quorum, but we can proceed with the workshop nonetheless. And I'll let everyone know when we get a quorum as well. All right, everyone. Thank you so much for joining. So I'm going to dive into our annual public workshop, and I'm going to start sharing everyone can see my screen, I believe. I'm going to go full screen here. All right, thank you, everyone. Josh Barber, MPO staff. I prepared a public workshop this morning on shared mobility and mobility as a service, and I want to go over a little bit why we're here. According to our commission, the Commission for the Transportation Disadvantaged, as part of our planning grant and our board meetings, we have to hold a public workshop annually at a minimum for the purposes of receiving input regarding unmet needs or any other areas that relate to transportation services in the county. And as part of the Plan Hillsborough strategic plan, we're looking towards exploring emerging technologies, including automated, connected, electric and shared use vehicles and modes, and what their implications are for the provision of transportation services. And of course, we've had a real upending of the transportation environment in the past 5 to 10 years with the rise of all these new transportation technologies. And so I'm going to go a little bit over some definitions, what shared mobility is, what mobility as a service is, what that looks like in Hillsborough County, how that relates to the TD system here locally, and then what some national projects look like and some drawbacks of these technologies. And we'll have some discussion questions at the end to go through. So what is shared mobility? Shared mobility is a motor vehicle, bicycle, or other mode that allows a user to obtain short-term access to that mode on an as-needed basis and doesn't require ownership. So we've had shared mobility for a long time. These look like our public transit, our taxis, our paratransit services, car rental. Those are our traditional kind of shared mobility services. But our emerging services look like bike sharing and car sharing, microtransit, and then of course, ride sourcing and transportation network companies such as Uber and Lyft, which we'll be kind of focusing on a bit more today. And in Hillsborough County, we have a variety of shared mobility services. Of course, HART with their fixed route, paratransit, and flex routes. Our Sunshine Line providing door-to-door service for our TD clients. T-BARTA has their van pool and ride matching programs. We have several transportation network companies operating in the Bay Area, including Uber, Lyft, and Userve. And of course, our electric scooter and bike shares. We have a car share system, Zipcar, and the downtowner will be leaving the city shortly, unfortunately. And then what's mobility as a service? Well, very similar. This is when we have an entity that brings together multiple mobility service providers and allows a user to access them through a single interface and pay and plan for mobility in a seamless way. And so we see that in the county with stuff like Flamingo fares, where we can pay for public transit for multiple providers through a single app. And same thing with Uber with their ride hailing and also other services as well. And then what does this have to do with us? Like I said before, this new technology has really upended the transportation environment. There's a lot more trips happening. We have people operating or working with TNCs and providing trips. And then we have these services operating in Tampa Bay, especially with Userve providing transportation disadvantaged services cross-county and late night. So it's important for us to reflect on these services and how they're impacting transportation here locally. And so here's some kind of examples of what other jurisdictions are doing. A few of these are going to be paratransit, and then a few are going to be TD specific. MBTA in Boston region has an on-demand paratransit pilot program with Uber, Lyft, and another company called Curb, and they're providing up to $40 of subsidized rides in the greater Boston area, just to supplement their paratransit service. One of the drawbacks of the program is it's subject to cancellation at any time. They're about to run out of funding, and so it'll just kind of disappear here soon. In Nevada, the Regional Transportation Commission has an on-demand paratransit pilot as well. This is where they have a little bit different of a fee structure where the client pays the first $3 and then the commission pays for the next 10 miles, which is about $30. And then they also have a program where veterans get a free ride up to the first 10 miles without having to pay that initial $3, only to veterans clinics though. But one of the drawbacks, of course, is that not all the paratransit clients are eligible. Their eligibility process is a bit unclear, and you have to kind of go through that, and you're not really sure if you'll be eligible or not. Here locally, we of course have PSTA's TD Late Shift, which was launched in August of 2016 with these companies, Uber, United Taxi, Care Ride, that provides ambulatory services or non-ambulatory services. And this program has been going on for a while and has been pretty successful, it seems, having national recognition. There's no cost for TD eligible clients that are commuting to and from work at night. And those clients get 25 free trips a month. And they're funding this program through Commission for the Transportation Disadvantaged dollars, where 90% of the funding is coming from the CTD and PSTA matches the next 10%. And then in Minnesota, this is a really unique program that they launched in Dakota County, which is just south of Minneapolis. This was a collaboration between the Department of Human Services, the county, and Lyft that started in 2019. And basically clients who are eligible through the social services program can get employment and other community access trips through this program, and they use Medicaid waivers. Basically, a subsidy is built into the Lyft app for clients, and those trips are paid for right out of Medicaid waivers for those clients. And they currently have over 700 riders, and it seems to be expanding when I was talking to the planner over there, and relatively successful. And so you can kind of see how these services are being used to supplement TD services across the US and even here locally, in addition to stuff like TD Tampa Bay. But I do want to go over some challenges. Some of these are stuff that you all have mentioned. Some of this is stuff that some national research. We of course have challenges with accessibility. Lyft, Uber are getting sued left and right by the Department of Justice and other entities for violating the ADA. And then, of course, you have issues with accessibility in terms of banking and smartphones. A lot of these companies require someone to have access to a bank and a credit card and a smartphone in order to book trips. And so how do you overcome those barriers for persons who might not have that kind of access? We have issues with public resources and competition. So these services are often competing with other public services such as transit. And so what are the implications of having these entities competing with our public services? There's issues with the fact that these are pilot programs and that their funding is subject to run out at any time. People become dependent, or not dependent, but start to rely on these services, and they might have the carpet yanked out from under them, so to speak, and that's a challenge. We have increased private vehicle demand as well, where these services are often generating trips that may not have been taken otherwise, which for TD services, not necessarily the worst thing. Happy to have new trips for people who are TD eligible. And often these companies are operating with a profit motive. So how do you balance their need to make a profit with our public goals, and what are the implications of that? And then continued other challenges. Many of these companies don't have there's not the same oversight of dispatch assistance and monitoring that we have on the public side, where they're answerable to public concerns. And the same thing with insurance coverage. Federal and state law often requires our transit providers and TD providers to have a certain level of insurance coverage that these companies don't necessarily have. And that brings us to this issue of liability. If there is a crash, who is liable, and what rights do passengers have if they are injured? And how is that different from the public services that are provided? And then that gets also into driver screening. So many state and federal regs require drivers to go through drug and alcohol programs, to be regularly tested, especially if they're operating a CDL vehicle. And there are companies that don't necessarily have as stringent of regulations or oversight of their drivers. And then issues of vehicle maintenance. Once again, the state and federal government require regular reviews of transit vehicles to ensure their safety, that they're mechanically sound, and that happens on an ongoing basis every year or 2 years. And you don't necessarily see the same oversight with personal vehicles be driven by contractors. And the same thing with training. As we all know, our Sunshine Line drivers are required to go through training and disability sensitivity, how to assist people with disabilities that other companies may not have. And then similarly with the data sharing issues, where you need to have a process to share data between the public entity and the private entity to ensure the services are meeting the needs of TD clients. And so those are just some drawbacks of the services. So what can the LCB do? What is our role in thinking about these new forms of mobility and new technology? We can continue to do what we've always done and advance the needs of the transportation disadvantaged. We can continue to, once again, facilitate integration and connectivity and accessibility within our coordinated system. We can continue to plan for a changing transportation environment and recognizing that, the future of these technologies are uncertain, but how do we best plan for them moving forward? And then where there are services being operated, especially services providing services to TD clients, what are our performance expectations? What kind of standards do we want to hold those services to? And so I'm happy to take any questions. I did have some kind of discussion questions for the board. You can see here, I don't know if anyone would like to jump in, maybe on how has the emergence of shared mobility impacted the coordinated system? How will it impact it moving forward? I'm happy to have anyone jump in on this.
Thank you. I don't see a hand raising function in this, but I do notice Mr. Brown raising his hand.
Thanks. Yeah, I couldn't find it either. I had a question when you were talking about the for-profit participants in these programs. And I was wondering, do we provide any sort of offsetting tax benefit to those to try to compensate and assist with that profit motive of theirs to further this, or is this simply something that we grant and then move forward by the way it's been being done? Do you know?
I'm honestly not sure, Glenn. I'm not positive. I know that, for example, with TD Tampa Bay, we do, the state provides funding for that program, but I'm not aware of any sort of tax incentives that are provided to these companies to help them, ensure that their services are generating enough profit for them. But I can definitely look into it a bit more.
And then as a follow-up and along the same sort of lines, is there some way for the liability section to set up some sort of bond with various tax collected funds to help kind of offset concerns related to liability in regard to those things that would help the private sector with this process as well? That was another sort of thing that occurred to me.
Mm-hmm.
That's it.
Yeah, I think that's a good idea. I think that's something that could be built into any sort of contracts that may be entered into between government entities where, we set expectations on what sort of insurance needs to be held and where liability will lie in the event of a crash.
Thank you. Does anybody else have any questions? No, seeing none. Was there any public comment for this workshop? No, seeing no public comment. I think we can adjourn the workshop at this time. Thank you very much, Mr. Barber, for an excellent presentation. I found the overview very informative and especially interesting to me, what is being done right across the bay with Pinellas, PSTA, and their rather robust program of mobility. So, hopefully as our local funding sources develop for HART, we may be able to do a little bit better job here. Right now, as you all know, HART is pretty stressed financially, but hopefully we will, be able to pass another transportation surtax that would help fund all sorts of transportation across the board in Hillsborough County, and step up on some of these areas as well.
Mm-hmm. Thank you, Commissioner. I appreciate it. And, happy to have the opportunity to just kind of, bring it up to the board and get y'all's wheels turning about how this technology is impacting us locally. So thank you.
Okay, so then we can at this point adjourn the workshop and reconvene as our regular meeting. And I'll call the regular meeting of the Transportation Disadvantaged Coordinating Board to order. And do we need another roll call for this meeting?
I don't think so. Mr. Porcel has arrived, so we do have an in-person quorum.
Okay. All right. We've established a quorum, and at this point, I'll ask for public comment for the regular meeting. Is there any member of the public wishing to speak here? And seeing none, that takes us to the approval of the minutes. Do I have a motion to approve the minutes from February 26th meeting?
I move to approve. It's Glenn.
I've got a
Second.
motion to approve, Mr. Brown, and a second by,
Cassandra Blaylock.
thank you, Ms. Blaylock. I guess do we need a roll call vote, or can we say aye?
I think
Mr.
we can.
Barber?
I think we can do aye for this one.
I think so too. So all in favor of the motion on the floor to accept the minutes from February 26th, say aye.
Aye.
Aye. I give them a minute to roll in. There's some delays in the technical formats, and then ask for any opposed. And hearing none, let the record show the minutes were adopted unanimously. The action items is the next section on the agenda. And the first one is the coordination contract with Brandon Sports and Aquatic Center, and Karen Smith of our Sunshine Line is listed as the presenter. Welcome, Ms. Smith.
Good morning. Yeah, I'm glad to hear we now have an in-person quorum. The Brandon Sports and Aquatic Center currently has a coordination contract with us because they are a 5310 recipient. Their current agreement will expire next month, so we will need approval from this board to enter into a new agreement with them to meet their grant requirement. Brandon Sports and Aquatic has 2 vehicles for a small program that they have called the Trident program, where they provide training and activities for people with intellectual disabilities mainly. So they're providing group trips back and forth to their center for those activities or for outings. Last year, all the numbers for these 2 items are for 1920, so they include several months of, it's the last whole year that we have reporting for. So it will include about 4 months of COVID shutdown, so it'll affect the numbers for both of these agencies. They provided just under 2,500 one-way passenger trips for 27 clients. At the time, they had 2 vehicles but weren't using both vehicles yet. I think they had just received the second vehicle. And their average cost per trip was $6.03. So we just need approval from the coordinating board to enter into a new contract with them.
Thank you. $6, how much did you say the average trip was?
Yeah, it's $6.03, but that's largely because they're group trips. So they're, group trips are much less than a one-on-one trip. So yeah, you'll notice it in comparison to the next, which is single trips or trips that we do. Yeah.
Right. That seems, just a remarkably economic way of transporting these people to a great program. So looking for any discussion and or a motion to approve the coordination contract.
This is Mike Lacey from APD. Just kind of as a note, that $6 is about average for like our, van rides and whatnot. So that's a pretty standard number. And then I'll motion to approve.
Thank you. Do I have a
I'll
second?
Glenn Brown, will second.
Thank you. Got a motion to approve from Mr. Lacey, second by Mr. Brown. Can we do this by a and nay? Yay and nay, Mr. Barber?
I think so.
Okay. All approved, say aye.
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 Okay, that's enough. And any opposed, say nay. Hearing none, Let's show the motion passed unanimously. And that takes us to the coordination contract with DACO Behavioral Health. Ms. Smith, that's you again.
There we go. Sorry, and Josh keeps changing my Zoom. I'm like, we're good. So DACO is another agency that currently has a coordination contract with us and has had 5310 vehicles for some time. DACO provides service for people with drug and alcohol disorder, and they particularly specialize with people with mental health disorders. In addition to that, they're providing transportation for their residential clients, and kind of in line with the discussion we were just talking about, their trips are mainly single trips for people going to appointments. So you'll notice their cost per trip is going to be significantly higher because they're not groups of people going all to one place. They have 11 vehicles and provided 8,600 trips. They did say that they had a significant drop in the COVID time period, so it affected their cost per trip because a lot of the costs are fixed costs, their staff, their vehicle insurance, their, a lot of things that they couldn't cut, but they weren't doing the trips. Those trips were for 393 clients, and their average cost per trip last year was $45.80. Their typical cost per trip, because I went back and asked them, they were hoping to attend, but I don't think they were able to be here today. Their typical cost per trip is $33.74. So the COVID reductions are what drove that cost per trip up to what is not typical for them. So just so that we're aware that that's not their normal. So I just need, again, approval from this board so that we can enter into a new contract with them as well.
Thank you. Any discussion?
I think Tracy.
Ms. Noyes, are you raising your hand? You're recognized. Are you muted?
Yeah, we can't hear you, Tracy.
Is there anything that can be done to unmute Ms. Noyes?
We're still working on it.
Okay.
Okay, testing. Okay, there we go. My apologies. Yes, I believe DACO was awarded a vehicle this fiscal year. My only concern is that how would they verify that these passengers are elderly and disabled in order to qualify for the Transportation Disadvantage Program?
Well, for our reporting purposes, we count more. The 5310, I realize, is for elderly and disabled for the grant. When they report trips to us, they're reporting low income, disabled, or elderly. But most of I would say many of their clients with a mental health disorder is considered a disability. So that in itself, the majority of their clients are going to be in that category. But they do report the unduplicated by category. I mean, the categories of passengers. I could go back and look at that from their last year's report, but it's part of what they report to us.
Okay, I do appreciate that.
But yeah, the breakdown of the clients.
Okay, that's all I had.
Okay.
Thank you.
Yeah, I can send that to you separately too.
Appreciate that.
And I still think the typical trip cost is quite economical for a door-to-door single user trip.
Yeah, even for a single trip, it is a reasonable cost. It's just higher than they typically have. Yes.
Right, right. And seeing no further discussion, and you can, if you want, ask something in the chat. I'm keeping an eye on that as well. But seeing no further discussion, do we have a motion to approve the recommended action of the contract with DACO Behavioral Health?
So move.
Thank you. Second?
Beth Pasek, second.
So I have a motion to approve by Mr. Councilman Vieira and a second. Couldn't quite tell who that was. Who's the second?
That was Beth Pasek, I believe.
Yes.
Okay, great. All in favor, say aye.
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 Any opposed, say nay. Hearing none of that, motion passed unanimously. And thank you, everyone, for working with our technical systems. Nice to hear that chorus of ayes come in. Everybody unmutes. So next item is the Community Transportation Coordinator Trip and Service Rate Approval. And that is also Ms. Smith, Karen?
It is. I'm just going to make you sick of me this morning.
Okay.
So every year we have to, actually, you could just switch it to the second one, Josh. Okay. Each year every CTC has to submit a rate worksheet to the State Commission for the Transportation Disadvantaged. It is what I need to change my Zoom. I can't see my own slide. There we go. It is included, the rates are included in the entire rate worksheet, I should point out, is included in your agenda package. It is an Excel spreadsheet that we complete for the state. So it has all the details attached in your agenda should you choose to look at it. But we are required to submit it to the state each year before our July grant cycle begins. It's included in the TDSP, the service plan, which we will be updating this year. And then the rates determine what we get paid, the rates that we get paid in the grant agreement. You can go to the next one. It's like I said, it's used to determine the rates that they reimburse us in the grant agreement. The trip and equipment, the TD grant, is a reimbursement grant. We provide the service and then we get reimbursed for the trips that we provide or the bus passes that we issue. So there's a reimbursement rate for each type of service, and that's what this rate worksheet determines. It does not determine the amount of the grant itself. So regardless of what the rates come out to be, we get the same amount of grant funding total. The amount that each CTC receives in the grant is determined by a separate formula that changed this year, but it's based on an estimated TD population, some levels of service provided, some street information. There's 4 or 5 factors that determine how much funding we get. So this will not change that amount. You can go to the next one. It is based on estimates for next fiscal year. So in some ways that's good because it doesn't include this year, which we all know is not normal. So it's based on our estimated revenue, expenses, trips, and mileage for next year. We plug them into the state's required rate worksheet, and the formulas in the worksheet determine what they're estimating, what they estimate we should be able to bill for each category. The grant does not pay the fully allocated cost for the trip. It pays a portion of it. It allocates the local funding in a way that has the local funding covering part of the cost. And then the grant covers the rest of that cost. That amount kind of varies year to year. It looks like this year the grant's covering about 73% of the cost. Last year it was 77%. It just depends how the formula falls out. You can go to the next one. And I should have pointed out that when I said that the grant formula doesn't, that this doesn't determine the amount of the grant. The amount of the grant we were originally estimating was going to be exactly the same as this year. We got the allocation estimates yesterday or the day before, and it's going to actually be slightly lower than the current year by about 3%. So it's going to be close to the same, but a little bit less. That's partly due to the fact that the formula just changed. So there's some shifts here and there. When you plug in all of those numbers, the cost per trip, which will be charged to the TD grant, would be $40.60 for an ambulatory trip, $69.60 for a wheelchair or lift, or a trip that requires use of a lift. The TD grant separates out a group per passenger, meaning it's a group trip, but the passengers may be getting picked up at they're all getting picked up at their house and taken to one place. So they're going together in a group of 5 people or more. And then there's a group per group, which they think of as you pick up 10 people at one place and take them all to the same place, kind of like a shopping trip from a residential facility or something. And those you charge just one flat rate for the whole group, which would be $75.02. Those rates reflect about a 4.5% increase over the rates for this year, which is relatively normal historical trend. We are estimating, when we were estimating next year, because this year has been so not normal, and because part of last year was not normal, we're essentially estimating that next fiscal year we will return to what we were the last kind of full year. So we're kind of looking at 18-19 as our normal with a very small increase, but that's where we are. We're just estimating that service levels will get back to there. We were told that some of the expense increases, there's the county had a increase to what all staff are getting for a minimum pay, so that affected some of the driver positions, and fleet is expecting that fuel prices will go up, so that's reflected in our budget request. So our expenses that we use to calculate this is based on what we're submitting for our budget request for the next budget cycle. So they said that'll reflect some pay increases, some insurance benefit increases, and some fuel increases, and those are mainly what are driving the like I said, the 4.5% or so cost increase. So you can go to the next one. What we need from this board is approval of the rates so that we can include them in the TDSP. I would point out that we have already sent a copy of the rate worksheet to the TD Commission staff for their review because they're required to review it. They have not gone back with changes, and that was about 2 weeks ago, so I'm assuming they normally will let us know if it's by this board meeting so that we can incorporate any changes. So I expect that approval will be fine. So they've been reviewing it, and then we need approval from this board just to have those rates in our new grant cycle.
Does that conclude your report?
Yep.
Thank you. I had a couple of questions, and seeing none from anybody else yet, let me just ask you, the other committee that is supposed to approve this, who is that? Which is that?
It's the staff from the TD Commission. So it's just our regional rep and the contract manager from the TD Commission staff.
And I mean, just theoretically, procedurally, I totally take your point that it's unlikely there's going to be any issue there, or we'd have heard about it by now. But procedurally, if that did come back with any questions, it would return to this board?
It would, or I looked last year, we hadn't received their comments back. Typically, the only thing that'll make us change is add some comments. But it was approved to include TD Commission staff changes if they had been requested, because the TD Commission is ultimately the one who's going to approve the rates in the end anyway.
I see. Is that
the motion could include to incorporate TD Commission staff changes.
Okay, so that's,
or we could bring it back and change something.
I would at least want this committee, our committee, to be advised if that happened, but I would be open to a motion from the floor to craft our motion that way, to approve the this service and rate inclusion in the update with any changes by this committee, if there are any, and with the understanding that any changes would come back to this board for update. For the sake of information.
Right, okay.
All right, let me wait. Let me ask you one more question while I'm waiting for a motion. Part of the increase in cost was from the pay increases of Hillsborough County. And I know we have been working towards and finally achieved $15 minimum wage throughout the county. Is that what is being reflected here in the pay increases, or kind of the ripple effect from that? Did we have any of these affected employees making less than $15 an hour? Do you know? Probably not.
I believe it was only some of the very new driver pay scale that changed. If Scott can correct me if I'm wrong. As far as I know, it was just we had a few very new drivers whose the driver pay base pay changed.
There were several, and customer service representatives and drivers that were at the very beginning of the pay scale.
Great. And I'm glad to see that accomplished in our community. It's important to spread that example, in my view. I see a question by Leslie Gordon. You're recognized.
Thank you, Commissioner. I can't seem to find my hand raised thing, so I had to put that in the chat. This is a question that might be a little bit random, but it's something I don't know. Can the Sunshine Line be used to, for example, go on a vaccination appointment to go get vaccine for COVID, or to go get tested? Can someone use the Sunshine Line for those purposes? Okay.
Yeah, absolutely. And we've been doing a lot of those. I think we did almost 200 last month vaccine trips. So yeah, anyone who would qualify for a trip with us can contact us, and then if they need to go to a vaccine. Yeah, and then some we're getting through emergency management. If there's, we had a mobile home park or some residential place that needed to get to, so we took a whole bunch of people because emergency management needed us to take them. So either they're an eligible client or they've got some other reasons that they needed to contact the health department. Yeah.
Yeah, it's the testing
wonderful.
that we wouldn't do, because if someone has the infection, we wouldn't want to spread that through the driver and the buses and the other passengers.
Right. Just a comment, because I know a couple of times, Karen, you mentioned that like last year was not a typical year, and I would just propose to you that maybe for the next year or two, those years may not be typical. So Sunshine Line would probably have to be prepared to deal with some other years that are not normal in terms of operation, I would think.
Yeah, even the state used, when they revised their formula, it would normally be based on the previous year's numbers to determine the grant amounts, and they had to use the year, I think they used 18-19 to get a stable year. Yeah.
Okay. Thank you.
Thank you. Are there any other questions or comments, discussion? Seeing none, do we have a motion on this requested action?
I move to approve based on your thoughts of modification, Commissioner.
Okay.
Great. Is that staff has that motion then? And do I have a second?
Second, Dr. Gordon.
Thank you. Motion by Mr. Brown, second by Dr. Gordon. All in favor say aye.
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 There we go, everybody. And any opposed? Nay? Nothing. Nobody opposed. So this motion carries unanimously.
Thank you.
And thank you. Thank you very much, Ms. Smith, for taking us through all those presentations. Good work. Our next item is the let's see, the grievance procedures and annual review and adoption. Mr. Barber, are you taking us through? Yes, you are. And it's my understanding that we need at this time to reappoint a subcommittee. Is that part of this? All right,
Yes,
I'll
that
turn
is.
it over to you and you explain.
Thank you. Thank you. So every year, thank you, MPO, Josh Barber, MPO staff for the record. So we're required every year to review and adopt grievance procedures. And really the purpose of the grievance subcommittee and procedures is to ensure quality control of the TD system and to provide users with users and funding agencies and other providers with a means to hear complaints and make recommendations on disputes or concerns with TD services that are rendered. This is a requirement of the CTD. And I've included our grievance procedures in our packet for 2021. There does not seem to be many grievances that arise to the point of needing to convene the grievance subcommittee. Only been, I think, 1 or 2 in the past 10 years or so. And really will only be meeting if there's a need to meet. If a complaint or a grievance cannot be resolved informally. And so our grievance procedures outline who will be a member of the grievance subcommittee. It is composed of 5 voting members, 1 user of the transportation services, 1 representative of a recognized disabled group, and 3 representatives of the LCB at large. And according to our grievance procedures, the grievance subcommittee shall be appointed by the chair of this board, which is you, Commissioner Smith. And our current grievance subcommittee is Ms. Mills, Ms. Pacifico, Mr. Harshberger, Mr. Forcell, and Ms. Castellano. It is my understanding that Ms. Pacifico, due to medical demands and other obligations, will not be able to continue to serve on the grievance subcommittee, so we'll need a new representative of a recognized disabled group. And with that, I'll hand it over to you, Commissioner Smith, to appoint the subcommittee, and I'm happy to take any questions that anyone might have as well.
Thank you. And it's my understanding that everyone else besides Ms. Pacifico is willing to serve, Ms. Mills, Mr. Harshberger, Mr. Forcell, and Ms. Castellano. So far, so good. If any of you are also wishing to transition off of that committee, speak now or but of course it's not if something comes up even next month or during the year, we can always appoint somebody else to fill your seat, so you're not it's not a lifetime commitment. I also understand that Ms. Deborah Knoll is willing to serve in that empty spot of that Ms. Pacifico will be vacating. And so I will appoint her to fill that seat here. And that would fill out our five committee members. Is there, and then staff can reach out to Ms. Noel and tell her that she's the new appointee.
Correct. I will definitely do that, Commissioner. Thank you.
Right. And thank her for stepping up and being willing to serve if need be. Okay, and yeah.
Could we
Mr. Forcell.
have a motion to approve the procedures and the appointment of the subcommittee.
Mhm. Motion.
So move, Vera.
You got a motion to approve the procedures as well as the subcommittee as nominated. Second,
I'll second. It's Glenn
and
Brown.
that was, oh, Mr. Brown. And Mr. Forcell, did you have your hand raised there for a minute?
I think
You're
he's,
muted. You're muted. I think
Maybe
they are.
unmuted. Okay.
There you
Yes.
go.
All right. I just had one little crazy comment on the form itself that people would fill out. A pet peeve of mine is the amount of space that's allowed for you to write something down. And oddly enough, the date and whatever have more space for that than your name and your address. So I would like more space for name and address and less for date. Just a silly little thing. Thank you.
Well, thank you very much, Mr. Forcell. Point well taken. And in my past life, I was a graphic designer who designed many forms and websites, and I concur that it looks nice to have those same spaces, but really it's the functionality of the space you have to consider. Thank you very much for your constructive comments there. Okay, so we've got a motion. We still have a motion, and to approve and a second, and seeing no further discussion, it's time to take a vote. All in favor, say aye.
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 We're getting the hang of this. Any opposed, say nay. And that motion carries unanimously. Thank you very much. We're doing a lot of work in short order today, and thank you very much, everyone. Next is status reports, starting with Cutter Equity Needs Assessment. Miss Tia Boyd, I understand you will be given this. Thank you.
Yes. Let me just, I can get my camera on. All right, perfect. Apologies in advance for any noise of little children you hear in the background. Yes, so my name is Tia Boyd. I am a research associate with the USF Center for Urban Transportation Research. And I will talk to you today about the Transportation Equity Toolkit. Next slide, please. So a bit about the toolkit. It is a resource for transportation planning agencies and communities as they work to advance equity. It provides a framework for a transportation equity needs assessment and an equity-based project prioritization process. It includes a number of resources and tools, but we did find some specific gaps in current practice, and so we developed two tools, the Transportation Equity Audit Tool and the Transportation Equity Scorecard. And I do want to note that throughout each of these processes, we emphasize community engagement as you identify needs and as you prioritize projects. It's very important to involve the communities that you are trying to serve. Next slide. So the first part of the toolkit focuses on the Transportation Equity Needs Assessment Framework to identify the specific transportation needs of traditionally underserved communities. Next slide. So to do this, of course, we would first need to know where these communities are. And to do that, we suggest a mapping process. So we would first collect socioeconomic and demographic information to identify underserved communities. And in the mapping process, we use the term communities of concern. And we use them pretty much interchangeably throughout the toolkit. We would then calculate the concentration of communities of concern. We do suggest the threshold-based method, but do encourage agencies to use existing methods that they may have in place to identify, map, and identify those concentrations. In the toolkit, we then identify, I'm so sorry for all the noise.
No problem.
We then identify and visually represent areas with larger concentrations of one or more groups of communities of concern. At this point, we definitely encourage staff to engage the communities in refining these boundaries. So once again, doing that groundwork. Next slide, please. Once the communities of concern are identified, the next step would be to inventory community transportation assets and existing conditions. So this would be done by first summarizing travel patterns and modes used, identifying current and proposed projects and services, and then using a mapping process. We suggest GIS to build inventory maps. You can see an inventory map on your screen where that goldish, orangish color is essential destinations, which includes employment, shopping, anything that people would need to travel to on a daily basis. You see the bus routes in that light blue. We include sidewalks, which is a thin orange line, bike lanes, which is a blue dotted or dashed line. And then what is, I think, the most important part about this mapping process is where are those issues occurring for pedestrians and bicyclists. So you can see we have circles and diamonds where the red represents fatalities, yellow represents injuries, and green represents property damage. So this is really the key. We then overlay the inventory maps onto the community of concern maps to identify where these assets are and where these collisions are occurring in relation to the communities. And that's where you would then do your deep dive. You would look into these. When we did this, this map shows the university area. We unfortunately were not able to go out, but we do encourage persons using this process to go out in these areas where these hotspots are and see what in the built environment, what in driver behaviors and other behaviors that are causing these collisions to happen. So then you would conduct those field studies and summarize the findings. We, as I mentioned, use Google Earth, and then we did work in collaboration with the university area CDC. Sarah Combs, their director, was able to send us some studies that they did where they were able to go and walk the ground and take some pictures. So we were able to use that to validate some of our findings that we looked at using Google Earth. Next slide. So we have, where our communities are, where some of these issues may be happening. And as I mentioned, we want to involve the community throughout these process. So we know where these community members are. It is important to use some creative and out-of-the-box techniques targeted to those specific communities and targeted at their needs to conduct outreach. We did find some interesting information on how to collaborate and co-create with the community, really making community members advocates for their needs. So they can advocate for those needs. They can go out and share exactly what those needs are. Next slide. So one of the ways we can do this to engage the community and reach the community and identify those needs is by conducting an audit. We include a transportation equity audit tool, which I include a sample of on the screen for the access to opportunity section. It includes 8 categories to create the community profile, evaluate transportation conditions and rank needs. And the audit is designed to be completed by agency staff, community organizers, and of course, community members. We encourage staff to sit down with community members or for community members and their any organizers, if they are able to go out, conduct the audit, and then in coordination with staff, begin to identify those needs. Next slide, please. The toolkit reviews some basic steps for the needs assessment or audit, as we refer to it, and staff also can engage volunteers to help those community members. So we just some general steps, which if you have participated in an audit, this is pretty standard steps. We identify and audit the team, select and identify those routes, select a date or several dates to conduct the audit. We do emphasize, if able, to do more than one date because it's important to see what those conditions are like in the morning versus the evening or during the week versus the weekend and during peak periods. So if there's time and funds and resources available, we definitely encourage you to go out multiple times. Collect existing data, which is typically done by agency staff. That's your census data, your local data that you have access to, and so on. Review and familiarize yourself with the audit tool. At this step, we encourage use the profile to identify if there are any potential language barriers, and solicit the help of a translator or someone on staff who is fluent in that particular language, to then be able to overcome those potential barriers while conducting the audit. And then share the tool with the audit tool and conduct your audit and identify those needs. Next slide. We do include methods to evaluate audits results and prioritize needs because we want to identify those high priority needs so we can begin to identify strategies, possibly some projects if funding is available, or to see if there are opportunities for funding to implement some projects that may address those high priority needs. We do encourage, as a general step, aside from the audit, just asking community members just outright, what are your top 3 transportation needs? And this will begin to organize and rank those needs to identify those top needs. The process for prioritizing needs should consider socio-demographic data collected in the community characteristics section of the audit and be considered with travel mode preferences relative to each equity category. So the socioeconomic data and the needs identified really drives this process. Next slide is the project prioritization process. It's an equity-based project prioritization process to help agencies determine which projects best advance equity and meet the needs of traditionally underserved communities. Next slide. The process involves 4 steps to define and locate communities of concern, select the scoring system and methods to conduct the evaluation and input findings into the scorecard, and rank and select projects. I do want to note that the process for the prioritization can be data intensive and involves a fair amount of technical knowledge. So this would be done by staff with, of course, input from the community. Next slide. So this is just a snippet of what the scorecard looks like. It is a spreadsheet-based tool. One of the graduate research assistants at Qatar automated it for us. It's very cool. It includes drop-downs. It'll automatically calculate the scores for your projects that you are ranking. It will rank those projects once those scores are calculated according to the equity categories we identified. So it's a very cool feature that he was able to include for us. Next slide will show the equity categories. So there are 5 categories for benefits and 1 category for burdens. We reviewed about 34 MPO long-range transportation plans and other literature to pull out those equity categories that were relevant for this scorecard. There are factors and corresponding criteria for each equity category, 1 factor and criteria for the burdens category. We do include non-weighted and weighted criteria for each factor, which I'll just show you a sample of what that looks like in the next slide or 2. Next slide. Yep, perfect. The concentration of communities of concern serves as a foundation for the scoring system. So if there is no concentration of communities of concern, this particular tool would not be an appropriate tool to use to score prioritized projects in that area. Low to medium concentration would get a score of 1. High concentrations would get a score of 2. And I want to emphasize that we do give those projects that cause adverse impacts or those burdens a -10, because we do want to kind of whittle out those projects and identify, we don't want to have those projects that may, for example, widen a road and create a dissect a community, or create issues with noise or pollution and really potentially reduce the quality of life. So we give those adverse impacts a -10. Each category in the scorecard can receive up to 6 points for a maximum equity score of 30. Next slide. So here's what the non-weighted and weighted criteria looks like. This is an example for active transportation. So for the non-weighted, we just want to know very generally, does the project improve or expand bicycle or pedestrian facilities? And that would get a yes or a no, and either a 1 or 2 depending on the concentration if it's a yes. So for the magnitude of impact, we want to go a little deeper, and this requires a better understanding of the community and a better understanding of the project itself. And we want to know, does the project potentially provide new protected bicycle facility or shared use path? Does it introduce a signalized crosswalk and so on? Does it do more? Does it provide additional benefits? And these would be multiplied by 2, so they'll be scored significantly higher than a project that would, for example, only have a sidewalk, which is still a good thing, but we do want to really highlight those projects that go above and beyond. The weighted criteria are customizable by the agency, and it may be changed based on the regional or community profiles or needs. Next slide. And so just when to apply, there are various opportunities to apply the scorecard. It can be applied within a broader project evaluation and scoring system, or as a separate or additional assessment specific to equity. And that is last slide. We'll have my email. That is it for my presentation. If you have any questions.
Wow, thank you so much. That was that's a very exciting presentation on a really exciting project. We have, as you know, at the MPO been looking at equity in transportation. We have been in our history, as well as how to go forward with that. Mr. Barber has done a lot of work there and is a wealth of inspiration and information there.
Absolutely.
But I'm sorry.
And I was saying absolutely. I do want to mention that we did work closely. The MPO is a stakeholder, and we work closely with Joshua and Dana and Allison and Wade, and they were very crucial in providing some very helpful feedback. So it was great to work with them on this project.
Right. I think I'm really excited about and enthusiastic about this direction that our county is beginning to move in considerations of equity in our transportation planning, as well as other areas in our county process of making progress for our future. Also, glad to hear Sarah Combs was working closely with you on providing that on the ground real detail, keep bringing it down to earth from a totally ivory tower Google Earth view. So I think that for your sample pilot project makes it really valuable as well. Sarah Combs is who you mentioned of the university area CDC, and she is quite a resource for that area and their needs. Because I think as you noted, Google Earth is great, and even these days Google Earth is able in a lot of places to get you right down on the sidewalk where you can see, geez, there's a utility pole in the middle of the sidewalk, so it seems like there's a sidewalk there, but it's actually making people go out into the street to get around that utility pole in a crucial, dangerous spot. So those kinds of or a bike lane being blocked in some actual on the ground way that might not show up on just the maps, you know, the high level maps. It's really important to get a real understanding of what somebody faces trying to navigate these actual systems. So can I ask you, where has this been shown and where will you be showing it and offering this tool?
Yeah, absolutely. So right now we've just sent it to CTED, who is the Center for Transportation Equity Decision and Dollars, who's funded the project. So we've completed on our end. We're just waiting on them to, of course, review, provide us with any feedback if necessary. It'll be published on their website. They're at the University of Texas at Arlington. We have discussed this with FDOT as well at Transplex, so that was a very exciting presentation, and several of the other committees with Hillsborough MPO. It is designed to be a national toolkit, so we did try to make it, of course, not specific to one state or one area. So we're still, looking for opportunities to share it and display it. We did discuss with the MPOAC, so at some point we will share it with the MPOAC, and just anywhere we can get it out. We think it is a very valuable resource, and we want to share it to as many agencies and communities as we can.
I'm racking my brain trying to think of which committee is the MPO AC.
The MPO advisory committee, I think it's committee. It's through FDOT.
At the top of some screen there, BPAC, Bicycle Pedestrian Advisory.
Yes, that was from a previous presentation with the Bicycle Pedestrian Advisory Committee. But the MPOAC is it's through FDOT, and they all MPOs are members of the MPOAC. It's a statewide.
Okay. Yeah. I'm getting a little help
Advisory
here
Council.
in the chat box. So it's the state MPO Advisory Council.
Yes.
That's awesome. That meets quarterly. Thank you, Ms. Alden.
Thank you.
So I see the chairs of the MPOs. That's great. I'm very excited about this, and thank you for bringing it here. I think it would be worthwhile as you wend your way through to have this presentation at our MPO here locally as well, so we know this is available. Any other? Dr. Gordon, I see you have a question.
Yes, I have a question. That was a very interesting presentation, and it was fast and a lot. And I'd like to learn some more about that, if it's possible for maybe you or Joshua to forward some information so that I can sort of read through it. So that's my first request, if possible. And then I wanted to know, Tia, is the toolkit somewhat like a health impact assessment? We have health impact assessment, and there's a process for doing it, but would you say this is another model for doing a health impact assessment?
It is similar. We did look at the health impact assessments when we began modeling to see how those were structured, what was included. So it is in the same, I guess, the same wheelhouse, or the same, possibly the same category of the type of analysis, but it does focus beyond just health. It does include health as a category, but it goes beyond to those categories specific to equity as they relate to transportation. So I would say it's similar.
Okay.
And of course,
and
on your first comment on once the toolkit is available, we will of course share it, pass it on to you all. I'll send it to Joshua and be sure that it gets to you all once the full toolkit is available.
Okay. And would you say that an agency would be able to utilize the toolkit sort of as an independent process, or would we need to engage, for example, Cutter to be able to fully utilize a toolkit?
No, we do not need to be involved unless you have specific questions. But it is, hopefully it is user friendly. That was our goal, to make it user friendly for the agencies and for the communities. The scorecard does require a little more information, but we do include quite a bit of detail in the user guide that breaks down how to use it, how to modify it, and what steps need to be taken. But of course, we are available if you do run across any questions.
Okay, thank you very much.
Thank you. And I see a couple more questions popping up in the chat. First, Miss Mills has her hand up. You're recognized. Miss Mills? I think we just have to do some unmuting here. Is that it?
No, they're working on it.
Okay, while we're waiting, I see that Ms. Noyes has asked a question about, is there any public input that contributes to these reports, such as surveys? Ms. Noyes, are you able to unmute yourself and ask your question?
Yes, ma'am. I was wanting to see what kind of public involvement or public input. Were there surveys conducted? And if so, how were they presented?
Right. To develop the toolkit, we did not involve any or did not do any outreach ourselves, but we did look into various existing surveys and literature that were done by various agencies, those involved in transportation and some not in transportation, some involved in equity on a broader scale. But we did not, we wanted to, but this project kicked off, early last year. And so we were a bit limited to what we were able to do. But we did try to use whatever resources were available online and through our stakeholders.
Understood. Thank you.
And then the process of using the toolkit would include a lot of public outreach at that level, right?
Right. The audit itself is a survey-based tool. So that part, when agencies use the toolkit, they would use it as a survey style. And we do include an outline that it can be in person, over the phone. It is designed to, it's a PDF, so it can go by email if wanted to as well, to use those various platforms available to the agency.
Thank you. So, Ms. Noyes, does that answer your question?
It does. I appreciate that. Thank you.
Sure. And Ms. Mills, is she unmuted?
Sorry about that. My question is that the people that are zooming in that are not here, can they see this? Because I can't imagine, I can't see anything on this computer, but can the people that are not here, can they see the, she keeps sliding I just want to know, because it sounds such a interesting, I would like to see it myself. And of course I'd have to have my special stuff, but that's my question.
Yes, ma'am. We are seeing it on our screens in the GoToMeeting structure, but per Dr. Gordon's point, I'm sure we all would like to have a copy when this is finalized shortly. And so we will all get this, receive this, and be able to go through it, ourselves slide by slide.
Thank you.
Mm-hmm. Yes, it is worthwhile. And so I hope after you see it, if you have any other discussion, you can bring that back as well,
Sure.
and contact Ms. Boyd. Allison, yay. Is that a question or a comment?
That was just a staff comment.
Okay, and Artie Fryer has a question. Mr. Fryer, you're recognized.
Yeah. Thank you, Commissioner. My question is in regard to communities of concern. I think you probably mentioned it, but I'd like to just make sure I get a better understanding of how those are defined. And I believe that the comment was made that there should be a concentration of communities of concern. So I'd like to know if the USF area might be a typical community of concern, and if it is there another here in Hillsborough County that you might be able to equate that to? I'm particularly concerned about demographics and residential kind of issues, home ownership and such. So does that kind of work into what makes a community of concern?
Yes, absolutely. We calculate communities of concern using census block groups. And the variables that we included in that, there are many. We highlight specifically low-income households, zero vehicle households, persons with disabilities, single family or single parent households, those with, we identify a threshold for income, so below the poverty level, as identified by the national threshold for poverty. So there are various factors that identify whether a community is a community of concern or not. And we typically say, is there one or two or more? And that's how we identify the threshold. I do know that you all have the in the health. It was if Joshua or somebody can remind me, the health atlas, I think it was, used the similar criteria for communities of concern, and I know that it's in the process of being updated for Hillsborough. And there are numerous communities of concern throughout Hillsborough County. It's just a matter of mapping it. I'm not a GIS expert or person in particular, but we do use based on the national average and establish a threshold and use the standard deviation to determine if it's above or below the national average for those different variables. So of course the variables would depend on the regional, so what the variables may be in Florida, and those criteria, they may differ slightly in somewhere, Midwest states or, more northern states. It's there's no set list in for from state to state. But university area did have some low concentrations and high concentrations. I don't know if Joshua can go back to the map on, I think it was slide 2 or 3. Right, so we can see in university area where the dark purple, that's where the high concentration was. And then the lighter purple, those were low to medium. Where you have no shading, it either was no concentration or the area was not, there was some type of other use there aside from residential. Does that answer your question?
Yes.
Okay.
Thank you very much. It amplifies it.
Good.
Thank you. And
Artie, I'd be happy to follow up with you and kind of discuss our mapping process as well, and how this aligns with ours.
Okay, great. Thank you.
Yes, sir.
I have a quick sort of comment. Apologies. Artie, it sounds a little like what they're doing is similar to what we've looked at in community development and a little bit in public health in regard to what we call vulnerability and vulnerability statistics and things. So it's, education, poverty, those sorts of things being the factors determining it. So, and it also sounds like a lot has been kind of borrowed and built upon from rapid assessment methods in sociology and community development. So and public health, sorry, doctor, make sure I get that in there. But it sounds like a very nice use and pulling those things together and elaboration on those techniques. Thank you very much, Ms. Boyd or Dr. Boyd. Or
Not doctor, just
okay.
but thank you. Yes, that's
Thank you.
exactly true. We didn't limit ourselves to only, those tools and resources that were relevant to transportation. We did look at a broad, many disciplines, and found what was relevant to equity and transportation, because we know there's a lot of intersection between these different disciplines and different needs, because transportation it's an avenue to many things. It's an avenue to employment, to healthcare, and so on. So thank you.
All right. Thank you very much. Thanks for all the board or committee discussion and questions, and Ms. Boyd for your presentation and answering and participating in our discussion. I appreciate that. Moving on, we still have 3 presentations left, and so I'm going to ask to make sure, see if we can't get those done in the next 30 minutes, because if not, I'll have to turn over the chair to or somebody else, because I've got an appointment after this. But let's move forward with the Flamingo Fairs update.
Okay. Good morning, Commissioner Smith, members of the board. Can you hear me okay?
Yes.
Absolutely. Okay, good. So I'm Linda Crescentini. I'm the Interim Chief Financial Officer with HART, and this presentation is to provide you an overview of the Flamingo Fairs program. We have some new components, critical changes, and very exciting news going forward. So next, please. So some of the items that I'm going to touch on today are what is Flamingo Fairs? We have a lot of benefits associated with the program, the features, distribution networks, some of the time frames, and I will go fairly quickly, and some of the functionality and reporting. And at which time I'll turn it over to Cherie Laparati. She is our HART compliance officer, and she has done extensive research out with our community, and she will touch on our Title VI compliance. Next, please. So what is Flamingo Fairs? Flamingo Fairs is an electronic payment system. It's an account-based system, so all the value is in an account. It's not on the card. And if you look to the left, that's the Flamingo Fairs trademark. It basically is the card program identification. You can use the card, you can use a smartphone, and currently we are underway for the ability to use MasterCard, Visa, Apple Pay, Google Pay, and that's an enhancement that will be coming over the next 12 months. Next, please. So there's 2 ways to pay for transit. We have, just like we had talked about, the Flamingo app, and all of this is up and operational today. So although we really haven't gone to the public with a full-blown marketing campaign, COVID kind of threw a monkey wrench into our public launch last year, but the system is up and operational. So you can download the Flamingo Fairs app on Google Play or Apple or the Apple Store, depending on what phone you have. And you can also purchase a Flamingo Smart Card. It's available at our customer service centers. There is a one-time cost of $3 for the new card and replacement cards, but they are available today. And then we'll talk a little bit in a minute about Retail Network, which is an extensive retail program where the cards will be easily accessible through our retail partners. Next, please. So where is Flamingo installed? Our partners are Hernando, the bus, Hillsborough, obviously us, Pasco for PCPT, Pinellas for PSTA and the Jolly Trolley, and Sarasota with SCAT. Next, please. There are a lot of benefits to the Flamingo Fairs program. We have fare capping, and this is probably one of the largest benefits that we offer, and this is pay as you go. A lot of our underbanked community cannot afford a monthly pass. So if you look at the bottom little table there, you'll never pay more than $4. This is in Hillsborough County specifically. Pinellas is $5. But in Hillsborough, you'll never pay more than $4 a day. You will, as long as you have the card or you have an account, it will max you out. And then your monthly max will be $65 if you're full fare. Currently, some folks can't afford the $65, so they wind up spending a lot more than the $65. But you will be capped at $65 a month, and you will ride free for the rest of the month. On the discounted fares, you're capped at $32.50 a month, and you will not pay a fare for the remaining days in that month. So that's one of the largest benefits. It gives us the ability to break down barriers to use it across the bay. So like I just mentioned, our partners earlier, and the balance protection. The money stays on the account, not on the card. So if you lose your phone, damage your phone, if you lose the card, your balance is protected. For heart, it helps with, people aren't struggling to find cash or exact change. So you will always have the ability to use your smart card. You have the balance protection. You also have auto reload. So if you want to set up your account so that if at a certain balance amount you want your card to replenish from your checking or savings account, then it will do that also. And all of this is done in advance, so boarding should be a lot easier. Next, please. So with some of that, there's fare structure changes. We went back to the HART board in December of 2020, at which time there is a transition from the current fare structure to the new fare structure. So some of the changes is the introduction of the smart card in the mobile app. We did have to get board approval to start charging the $3 for the card. And we did have to get board approval for our monthly and daily cap. Next, please. So the discounted fare structures, this is really a benefit to the folks that use the discounted fares. Currently, you have to go into the office, you have to get an ID, and you have to show that ID as you board. Your new Flamingo card will be your ID. So instead of having two different forms of payment, with your payment plus your ID card, your Flamingo card will have your picture on it. You will do the regular go into the customer service area. You'll get your discounted picture printed right on the card, and that's how you'll use it going forward. And you can also, at which time, if you choose to also want the mobile app with the discounted fare, you just let our customer service rep know that, and they will link those accounts so you can have access for your discounted fare on the card and on your mobile app. Next, please. So with that said, what is the distribution network? Currently, you can pick up the cards at the transit centers. You can pick up the cards on the app. Our website is up and operational. And our retail network, we're currently in system integration testing. Eventually, we'll have over 500 stores in the Tampa Bay region, and it will be like 7-Eleven, Publix, any normal retailer where you can go in and buy a gift card. We are working out all those agreements now, and there will be over, like I mentioned, over 500. We'll have 20 locally that we're doing test marketing with, and some of them are smaller mom and pops. They're not necessarily, large retailers. But we are doing a training program with our partners in PSTA with Ready Credit is the team that has the contract, and we want to make these cards easily accessible. So like you had mentioned with underbanked that might not have an account, they can go into one of these store locations and load funding onto their card. Next, please. This is just a timeline. It's taken us a while. Typical projects of this size take 3 to 5 years. We took 4, but it is because of complexity that we're dealing with all the different fare structures with all of our different agencies. Next, please. So like I mentioned, all the functionality for all the consumer-facing benefits are up and operational. we're working on our institutional accounts. And when I mention institutional accounts, our retailer manager is working with the VA hospital to be able to have an institutional account set up for them, juvenile justice. This allows them to manage their own accounts, and it's a benefit to them because, say, USF or a larger institution like an educational institution would be able to turn cards on and off depending on if the student or faculty is enrolled at that time. So some of our later functionality will come with the open payment, like I had mentioned earlier, the ability to use MasterCard Visa without actually having an account. Next, please. You might have to hit this a couple of times. This gives us tremendous reporting structure. Our ridership is going up even without a full marketing campaign, but I won't go into too much of this right now. Next, please. So there are proposed changes. We have a 6-month transition time, at which time our existing fare structure is still in place. We are transitioning through July 1st to be fully implemented up on the Flamingo fare structure, like I had mentioned earlier. And if you think about it, it's to simplify our fare structure. You no longer have to buy, a certain pass. Think about it as it's an account base. You have funding in your account, and it's a pay as you go. So you get maxed out at $4 a day. And you don't have to worry about all the different types of fares and do I need to buy this fare or that fare. It's more of the account base, which simplifies the structure. Next slide, please. This time I'll turn it over to Cherie, and she'll give you all the exciting news that she has done with the research and outreach to our community.
Great, thank you, Linda. Hello, everyone. Thank you for giving us this opportunity to speak to you about Title VI and our and how we conducted this analysis. For the record, this is Cherie Leparati, the HART Compliance Officer and Title VI Administrator. So HART conducted what we call a fare equity analysis in accordance with the FTA and also with our HART board policies. Through the fare equity analysis, HART identified, developed, and applied mitigation strategies to the e-policies that, without mitigation, were deemed likely to trigger a disparate impact on minority populations or a disproportionate burden on low-income populations. Recognizing that, historically, we know that transit-dependent communities often do not participate in traditional means of soliciting feedback. Therefore, HART engaged local community-based organization leadership to facilitate those discussions and gather feedback with their program participants that were determined to be from low-income minority populations and people that use our services. HART HART, through its Title VI Compliance Committee, utilized our membership to work with the various departments and other stakeholders to include finance, project management, operations, marketing, and other key stakeholders on the project to develop and implement those mitigation strategies, designing them to eliminate or significantly reduce the potential adverse effects of the identified e-policies on the target populations. We then utilized the feedback from the public engagement activities that were facilitated through the community-based organizations to incorporate those that feedback into the development of the e-policy mitigation strategies. So it was through the e-fare policy, through the e-fares implementation phase, and at the 3-month, 6-month, and at the 1-year mark after implementation, so that's in the near future, the data related to the ridership activities of our target population, transit-dependent population, will be gathered and analyzed. If warranted, a recommendation for corrective and remedial action will be developed and implemented to prevent discriminatory treatment in the form of a disparate impact on low income or disparate burden on minority populations from occurring. Next slide. So talking about, I mentioned our e-fare policies. This is just 2 of those policies. We actually had identified 7. Through the e-fare analysis, HART identified 7 e-fare policies that we felt could have a disparate impact on our transit-dependent populations. So using the expertise of the Title VI committee members, HART developed the strategies and then sought input on each strategy by engaging feedback from the target audience, and that was engaged through the community-based organizations. So for example, through the analysis, HART identified e-policies that could cause certain populations to be treated differently, and then work to minimize those strategies. So for the example, one of those was the e-fare media transition. We felt that people, if we're transitioning from paper passes to the e-fare card, we wanted to make sure that everyone was aware of this. We wanted to make sure that we developed specific marketing materials and strategies that would engage populations that do not speak, that are the non-English speaking populations, as well as people who are illiterate, as well as people who have disabilities. That means they may not take notice of our traditional poster type campaigns. We also looked at the e-fare, the e-policy for the minimum load, and as Linda mentioned, we took precautions to make sure that people who are low income or maybe have large families, if they can only afford maybe $2 to load, we made sure that we allow no minimum. People can load 50 cents, $1, $2, $3, or however much they need to add by going to any one of our retail locations. Another one of those examples was the elimination of the day and monthly pass. We wanted to make sure that we found, just from speaking to our public, that people were concerned about that, especially community-based organizations. So we're therefore allowing single-use e-fare options to continue. We also are implementing what they call an institutional account, which means that the community-based organizations, family members, and other organizations can add money to an individual's card. So that's kind of an overview of what those e-policies look like. Next slide, please. And then to wrap it up, HART will continue, again, to monitor the e-fare policies for its effectiveness, fairness, and sustainability during and after implementation, and will make adjustments as needed to ensure that no person is denied participation based on their race, color, national origin, or income in any of its programs or services. Are there any questions?
Well, thank you. This slide certainly, that last slide certainly looks like a diverse group, but it includes like an outsized representation of the redheaded population. Like, right, an awful lot of redheads in that, but you know, redheads are people too, so
this
good. Good to see them included.
I have a quick question.
Yes.
And I know we're moving on. Here at the Children's Board, we often, this COVID has been a little different, but we have spent tens of thousands of dollars in our ASO funds buying bus passes for people at various agencies. Are you going to do some form of training or outreach to agencies like ours to help us adjust quickly? Because this has been a big deal for getting people employed and getting people places. You guys have been so important, and the bus pass is a sort of critical issue. How are you going to roll that out? And I don't want to take too much time, so.
Sure.
No,
Thank you.
and go ahead, Sri.
Oh, I'm sorry. Yes, I think that's a great question, Glenn, and thank you for asking that. What we are going to roll it out. Linda is probably a better person to answer that than I. But one of the things that we did when we were including community-based organizations, we actually conducted, I think, a little over 50 WebExes and live presentations to the community-based organization leadership, their staff, and also their program participants. And if you would like to participate in that, I can certainly make that happen. But I will also turn it over to Linda because she probably has more about the actual rollout.
Right, and we are working on the institutional accounts now, so absolutely. we can get you training and we can reach out. So if you just send your contact information, we'll get back in touch with you and look at the accounts and start, you know, getting you educated and ease of access. So absolutely, whenever you're ready.
Thank you.
Thank you. And I see another question. I don't mean at all to stifle discussion or questions when I say I'm keeping an eye on the clock. I will have to leave shortly after 11:30, but that doesn't mean we can't turn the meeting over for final presentation if need be. Yes, I see. Mr. Forcell. Thank you. Sorry.
Craig is fine. Can you hear me?
Yes.
Okay. I had two quick questions about the $65 a month. That is regardless of the number of uses. They could go crazy and ride the bus all day at $65 a month.
$65 a month, absolutely. You will ride
Okay.
free for the rest of the month. That's correct. Now just make sure that you realize, you know, from Hartz, because of fraud, when you have the card, you register the card, you put your information, then once you reach that goal, once you reach either the daily cap, you will be maxed out at $4 a day, or you will be maxed out at the $65, and you are free for the remaining month.
All right. The second question is, it's a calendar, as in you spent 65 in February, March, not 30 days period from when you bought the card. Is that right?
Yes, I think that's how they have it set up. It's not. It doesn't cross. It doesn't cross months. You know, you're within that monthly time frame.
Thank you.
Absolutely.
Good questions. Anybody else? Going once, going twice. No questions in the room? And thank you very much for that presentation on the Flamingo Fairs. That's another exciting program and has a lot of benefits to the community.
Thank you.
All right. This brings us to the Transportation Disadvantaged Tampa Bay update by Mr. Holmes, I believe, will be presenting that.
Yes, thank you, Commissioner. Can everybody hear me?
Yes.
Okay, great. I'm going to give you an update on the TD Tampa Bay program. We began operating in the TD Tampa Bay program in the 5-county region of Tibarda, which is the Hernando, Pasco, Pinellas, Hillsborough, and Manatee counties back in December. And we're getting ready to put in another application for fiscal year 2021 and 2022 that will begin, of course, on July 1st. This partnership between user and Tibarda provides cross-county trips, provides evening and weekend trips for counties when the service is not being provided, where the CTC is not providing service during that particular time. We always want to make sure that we tell folks that we not to supplant any of the services that the local CTCs are doing. This is a supplemental service. That's why you all are very aware, and Craig, I know you are very aware. I think of Becky quite often when she talks about cross-county, when she used to tell us about cross-county trips. This service is for cross-county trips and for evenings and weekends. And as long as you're a TD eligible individual in Hillsborough, Manatee, Pasco, Pinellas, Hernando counties, and we have an application for the individual, then they will be are qualified to participate and ride in our service. The overall purpose of the program is to increase a transportation person's access to employment, job training, healthcare, other life-sustaining services, just like the regular TD program that you all are very familiar with. It's also to enhance regional connectivity. That's why we are focusing on cross-county trips. It is an on-demand service. It's door-to-door. We have both ambulatory and wheelchair accessible vehicles. It's direct, non-stop, and it's provided by credentialed drivers. Joshua, you had a really nice slide earlier where you talked about the challenges of the TNCs, and I'd like to tell this committee, the LCB, that that we have taken all those issues and we've addressed those issues in that slide that Josh was talking about. So when you're talking about a user driver, you're almost talking you're talking a TNC driver, which is an independent contractor, but they have been through the training, the background screening, everything that a driver would have that would be operating for a paratransit organization. We've run them through a drug and alcohol, all those issues that Joshua had on that slide. We've built this company to operate in that environment, to be able to provide paratransit-like services to individuals through a TNC platform. I know, Madam Chair, you need to be moving on. Let me talk about some data, where we're at so far this year, what we've done in the Hillsborough area. Well, overall, up until April 1st, we provided 1,256 trips across the region. In Hillsborough County, we have provided 244 trips to residents of Hillsborough County. Those individuals have primarily used that service in the other life-sustaining category, followed immediately by medical trips. Employment is and social activities are the next level of trips individuals take, which is it's significantly different proportion of trips compared to Pasco and Pinellas and Hernando counties. Many of those individuals, many of those counties use this service for employment, whereas in Hillsborough County, many of the folks will use that for other life-sustaining and or medical trips. I'm going to go back just slightly and mention that of the 1,256 trips that we provide across region, 878 of those have been for cross county, which is 70% of the trips. So we're meeting that need of individuals who need the cross county trips. And primarily, a lot of folks are coming into Hillsborough County, while the residents of Hillsborough County are using it for other life sustaining and medical. Many of the individuals from Pasco, even from Pinellas, are coming into Hillsborough for employment and or medical trips to Tampa General, to the VA hospital, etc. So that's how the individuals are using the trips for the TD Tampa Bay program. It's getting close. I want to provide time for people to ask questions. So I'm going to stop with the presentation, Madam Chair, and just open it up for questions. It's probably more effective over the next couple minutes to answer people's questions than to continue to talk about on a standard brief.
Thank you. Any questions or committee discussion? And I see there's a hand raised. I can't tell who that is behind that mask.
Miss Mills.
Oh, Miss Mills, thank you. Miss Mills, you're recognized.
Thank you. I've heard this presentation before, but it wasn't clear if you have a PCA person that you have to take with you if you're shopping or you need assistance. Is a person the $6 fare on the person that is with you?
The PCA, great question. The PCA rides for free.
Thank you.
You're welcome.
Yeah, great question. Anybody else?
Do you have how many wheelchairs versus ambulatory you've taken?
I think our percentage of wheelchair to ambulatory is about 15%. I think it's running right. It's running just a little lower than our national average, which is about 20%. So it's 15-16% ambulatory compared to 84-85%. I mean 15 to 16% wheelchair compared to the 84-85% ambulatory.
Anything else?
Is UServe using only their internal drivers, or do they contract with other providers in the county, each county?
For our ambulatory trips, we're using our independent contractors. For our wheelchair accessible vehicles, we are using contractors wheelchair accessible vehicle contractors in the region.
All the trips that are ambulatory are internal UServe contract employees or contractors, correct?
That's correct. They're independent contractors. That's correct.
Through UServe, so there's no contract for ambulatory. There's no contract for ambulatory services for local providers.
That's correct.
Okay, thank you.
Thank you.
And
Anyone
one
else?
last thing I'll mention, Madam Chair, is we're getting ready to go in front of the commission. We're sending our application in next week. If the local courting board would, we've already received a letter of support from the MPO. And thank you, Joshua. If the LCB would like to send us a letter of support, we would certainly appreciate that also.
Thank you. This was not listed as an action item, but it is a part of our agenda. If there were such a motion or any motion in that direction, we could consider it. If not, the recommendation of the MPO will serve you well.
Thank you.
Thank you. And did you have anything else to add, or?
I'm done, Madam Chair. I'll answer any questions or shut up.
All right. Well, thank you very much. I think that wraps it up, and we're all getting kind of sensitive to the 2-hour mark. We did have one more status report that wasn't listed on the agenda, I believe. Sunshine Line update.
Thank you, Madam Chair and board members and staff. Scott Clark, Director of Sunshine Line. For those who don't know me, I'll try and make it real quick. I do have a lot of information to cover, so I'll put my New Jersey talk on and talk real fast. So as Sunshine Line, we fared well through the pandemic, pivoting and adjusting service, providing essential service, quarantine and isolation, return trip transportation, delivering meals. Now we're working on vaccines. With that, we're providing transportation to the many vaccine sites, the state, the FEMA, county sites, and also the communities, the commercial sites. We've done over 150 trips, and you may think, well, that's not a lot of transportation, but there's a lot of coordination with these different sites because each site has different protocol, and we can't have buses sitting and waiting in long lines and things like that. So we have to coordinate a special entrance into the site, the staging area. We also coordinate where the staff comes onto the bus, administers the vaccine, and we wait for the period of time to make sure there's no reactions before we take the individuals back home. So that works very well and very great coordination. So one of our goals is to restore transportation disadvantage service to pre-COVID-19 levels. With that, we're doing a lot of different things. Our trips have increased 22% over the last month. Incoming calls 24%. And one of the things, we have air purifiers installed in all the vehicles, and I have one right here. Let's show you. So that's an air purifier that's in all of our buses, and there's UV lighting in there, which purifies the air, and it also has a nodule in there that turns the air into hydrogen peroxide, H2O2, and which is a disinfectant within the vehicle. We're also installing barriers on the passenger seats, and once we do that, we'll be able to increase our capacity from 3 passengers to 6 passengers, where we can do our group trips again and serve our 30 senior housing facilities. And right here is one of those barriers, and we'll get these installed in all the vehicles. We put the prototype in. I noticed 3 safety issues which the manufacturer has resolved. One of them being a cushion right here for a little metal box where if someone hits their head on it, it would be catastrophic. So we got a cushion built for that. And there were some gaps in it where some contagions can go through. So we got that also fixed. So we'll be installing these shortly. Aging services, they're working on a plan to reopen. So July, we'll be starting our senior nutrition program, August adult daycare. So that's going to increase that. We're also preparing for the upcoming season. I won't mention the H word, but all our employees are going through the know your role, so they know their emergency and disaster roles, and they're preparing their individual disaster plans with them with their families. And we're also doing a major update to our emergency plan. And with that, that's pretty much all I have. Are there any questions?
Thank you, Mr. Clark. Thanks for putting on your New Jersey speed talking experience and leading us through that. But that was very informative, and glad to have that update. Are there any questions? And a discussion? No, you answered all our questions in that concise, meaty presentation. Thank you very much.
Thank you.
And we had another item on the agenda, but I understand that we are able to defer that transportation surtax impacts discussion till our next meeting. That would be all right with Mr. Brown. Is that correct? We can defer that discussion.
That's correct. It doesn't make sense to me to have it without you, without a commissioner here. So
thank you. Thank you for your understanding. I was about to say, hey, reach out to me, but we can't because this is a sunshine committee. But yeah, we'll take this up another time. This is a matter that is going to take some time too, so it's not that time sensitive. Does anybody else have any old business or new business before we adjourn? And seeing none, I'll just wish everybody a happy weekend. Stay safe. We have the light at the end of the tunnel in front of us with COVID, but everybody please continue taking precautions until we get to the end of the tunnel. And with that, we are adjourned. Thank you very much.
Thank you.